Hello, I'm Dr. Anthony Wheeler, and I'm telling you everything that you need to know about pathology. What do we have here in this image? This is the gross pathology of subacute bacterial endocarditis, likely taken from an autopsy. We're going to be talking about endocarditis pathology. This is covered in your book, Medical School Pathology and Step 1 Review. You should have access to the website where all the updates are made regarding notes, lectures, things to make sure you advance and succeed to the highest levels. You can scan this QR code if you haven't obtained the materials yet. But I know you have because you're not a procrastinator, else you wouldn't be here. You'd still be utilizing outdated material. Anyhow, let's discuss endocarditis. Endocarditis is inflammation of the endocardium. Endocarditis is typically brought on by a bacterial infection. Streptococcus viridans is the most frequent cause of endocarditis. Streptococcus viridans is a low virulence bacteria that spreads to damaged valves. Damaged cardiac valves are commonly due to chronic rheumatic heart disease and mitral valve prolapse. With regards to rheumatic heart disease, this leads to small vegetations that don't destroy the valve and thrombotic vegetations from ongoing damaged endocardial surfaces that have formed. And temporary bacteremia causes microorganisms to become trapped in the vegetation. Right? So you have this buildup of subacute endocarditis compounded upon platelets and fibrin and bacteremia from the microorganisms. Fortunately, prophylactic antibiotics reduce the risk of endocarditis. Common associations of endocarditis include IV drug use, right? Patient walks in homeless for the most likely vignette scenario, utilizes heroin, multiple needle tracks, etc. With those types of patients, Staphylococcus aureus is the most frequent cause. IV drug user, Staph aureus. On the flip side, prosthetic valve endocarditis is linked to Staphylococcus epidermidis. And for patients with gastrointestinal cancers, such as colorectal carcinoma, those patients have endocarditis that is classically associated with Streptococcus bovis. Now, high virulence organisms may infect normal valves, most frequently the tricuspid valve, leading to large vegetations that destroy the valve. HACEK organisms are linked to endocarditis with negative blood cultures. And the HACEK organisms which you must know include Hemophilus, Actinobacillus, Cardiobacterium, Eikenella, and Kingella. You will likely see this, so make sure you know the HACEK organisms. Now, clinical features of bacterial endocarditis include fever, murmur, Janeway lesions, which are erythematous non-tender lesions on the palms and soles, Osler nodes, which are tender lesions on the fingers and toes, and splinter hemorrhages in the nail bed, as well as anemia of chronic disease. Laboratory findings of bacterial endocarditis include positive blood cultures, unless it's a HACEK organism, and anemia of chronic disease. Transesophageal echocardiography is helpful for evaluating the cardiac valve lesions. Sterile vegetations that develop in conjunction with a hypercoagulable condition or an underlying adenocarcinoma are the cause of non-bacterial thrombotic endocarditis. Mitral regurgitation is brought on by vegetations that grow along the lines of the closure of the mitral valve. And Liebman-Sachs endocarditis is a non-bacterial thrombotic endocarditis that is associated with systemic lupus erythematosus. Now, what classic features does a patient with SLE have on their face? Yes, you remember that butterfly rash, malar rash, right? And side note, what specific antibodies would you expect in a patient with SLE? Anti-dsDNA, right? Also keep in mind ANA as well as anti-Smith antibody, okay? With regards to endocarditis, the mitral valve has vegetation on its surface and underneath, which is what's causing the mitral regurgitation. And here we have an example from an autopsy specimen, grossly, of a heart that's been opened. Note that this pathology shows the subacute bacterial endocarditis involving the mitral valve. And with that, we're all done with this presentation. Hit on some key points, some must-knows. In particular, don't forget about the HACEK organisms, right? Those are very high yield. Keep up the good work. Keep studying, keep growing, expanding your mind, going deep into the material. And I'll see you later. Ciao.